She's a doctor.
Hi, I'm Dr. Dovec, and she's a dietitian.
Hey, I'm Hannah Schuyler, and together we are the Weight Loss Collab.
Nailed it.
Nailed it.
And we're back together.
I know.
First time just you and I in this space.
In this space. I know we've had some amazing guests the last couple of episodes, but we just like it being us.
I know, we did. So, what's been going on?
I know. It has. Tell me about what's been going on.
Yeah, so this is our first episode since we opened and did surgeries in the Surgical Institute of Central Florida.
What a day that was.
It was awesome. It's a day I will never forget. Okay, let me tell you guys, I know a lot of people follow us on Instagram and they know the story and they've seen the footage of it being dirt and then, going up in cement blocks. And then ultimately, we are getting close. And then you get the approvals to do it and you can finally do it. I mean, I've said this many times, but I just completely underestimated this project.
Oh, yeah. Well, how can you? I mean, you don't know what you're getting into. And it's like, oh, it's a building, right? People build buildings all the time.
Right.
But then there's layer on layer on layer on layer on layer on layer. And then even things like looking back to some of the approvals, I mean, a hurricane impacted all of this and pushed our timeline. And it's just things that you can't even factor in going into it that it's like, oh, great. Our inspection was, moved back because there was a hurricane.
I know. And it's talk about being dynamic. It's even looking at people like you in the very first day, you came before 6 a.m. to be the front desk.
Yeah, being somewhere before 6 a.m. is a big deal. Just would like to point that out.
I don't know if you noticed, but Aaron, my husband, when he saw you, he kind of started to cry.
I was going to ask if he cried that night because there were 3 distinct moments that he almost cried during the day.
Well, he was one of them was about you.
Yeah.
He said, when I saw Hannah that morning, it just choked me up, because this isn't just come into my work a little early. This was, I'm there and I love you.
Yeah, right. Exactly. It's a little bit more. So yes, no, he did tell me that. And I was like, what? I got to tell him that the bunk guy was there. And, because obviously we needed our bug treatment the first day we were operating. Definitely. We needed to ask if we needed anything indoors. If we didn't, no bugs inside. And I was walking up. He's like, Hannah, just thank you for being here. And then later with the nurses, he was just like, I know it's really busy, but if you guys have 1 minute, I just wanted to say how thankful I am and all this. It was really sweet. But I was like, I feel like it's been a lot. Oh, actually, then it was really funny because then you came out and you needed something. And he's like, oh, what do you need? He was always back. I was like, all right. Back, that was sweet for a minute. But
yeah, that was a moment. But it is. And that's kind of been what's been powering me is this visualization, this manifestation of this moment of having the bed leave after a first successful case.
Yeah.
That we didn't miss one detail that was mission critical, just trying to get the medications and everything stocked and the supplies and the people and the trainings and the inspections and this, like you said, layer upon layer of things that when you look at it, I mean, I've been doing this in and out of a hospital for over 20 years, right? When you really think about it from medical school and you're like, I know it. I know my surgeries inside and out. I know every supply, I know all of this. But when it comes to ordering it and is that the right IV that the nurses want? We didn't forget any major details.
Yeah.
And we went through many kind of trainings and mock walkthroughs and just to be in there. And then it kind of was anticlimactic, to be honest.
It wasn't. I mean, it was just kind of humming right away. It was the nurses were just being nurses and they were taking care of the patients and they're bringing them where they need to be and they're helping them out and they're charting and, just it's quiet. We did 5 cases that day and of course it was staggered. So there were never more than I think 2 patients really, 2, maybe 3 kind of in the pre and post-op area at a time. And so it was just kind of quiet back there. And, there were reps and things, but it's a big enough space that it never felt crazy busy or overwhelming. And I don't think anybody was panic. Nobody felt like they were rushing through things. Everybody was just moving through their day.
Yeah, it was just another day. I can't. When the lights went down in the OR, we always talk about that. But when we turn off the lights, we perform the surgeries in the dark because we're looking at screens and it just lets you see it.
Mm-hmm.
And I literally just felt like I was any operator on the
Unreal.
planet. Yeah, I guess. And I was kind of trying to get like into the emotions of it and think like, man, this was like just an idea. And then it was something that we built. And I was standing in here like with my jeans day and just, like with a sloppy ponytail on a Sunday, like trying to like wipe something down. And
Yeah.
like, no, it just feels like a regular old gastric bypass.
Which, I mean, is what you really want.
I know.
We did talk about getting balloons.
Really?
And then we realized Party City has since closed. And so we could not find a balloon location. And then actually, funnily enough, I, in my personal email, got an email from Michael's like yesterday that was like, we're now selling balloons. So I texted Erin. Then I said, hey, FYI, some future balloon needs. We can go to Michael's.
I know. We needed that balloon with the number one.
Yes.
That's the most important balloon of all time. The one, we've done a lot of cases, a lot of things, but no, it was a huge thing. I mean, truly, thank you for getting on there. And just not even that, you guys have no idea about the behind the scenes that like Hannah has just is just malleable. You just like bend and twist into whatever we needed to do. And
yeah.
So
Yeah.
I feel now like I didn't realize it, but it was just kind of like dark. Like it is like it's dark and it doesn't feel like you're ever going to come out of this cave. And by doing these surgeries, I do see light. I feel like there's like a little sliver of light. We're not quite out yet in terms of there's a lot of things that happen. And I'm like, okay, like I told you, I went to the gym for the first time in like a year.
Yeah.
And that was, I don't know, like when you look at it, like, okay, am I losing myself here?
Right.
This process? Am I like losing my family? Like, if what is fun? Like,
Right.
I don't like have like free time or fun time. I like put everything into it. I felt like just so much immense pressure. But now that it's like, okay, patients are coming and people see it. And then when people are like, it's beautiful here. I love the experience. The nurses and everyone was just so kind. This was just so great. I'm like, it's all worth it. And it's going, and you can see it now. Like,
Absolutely.
all right, let's do this thing.
Yeah. And you've already done another day, a couple of cases. Like, and that's the great thing too, is, I mean, we have the team on the other end on Body by Bariatric side that has just kept things humming along with that. And then they've so seamlessly transitioned those people over to this facility. That has been just, it's like, okay, great. We'll take care of all of that. And so, I mean, again, not without hiccups and trials and just all sorts of things that have to go in place. But we figured that out. And it's like, okay, now it's just will become business as usual.
Oh, so true. And thank you for bringing that up. I do want to acknowledge all the people behind the scenes. The whole team, like Body by Bariatrics is still going, and and now it's like, okay, I get to come back, and it's like I'm like reinvigorated, and we can't wait to now truly open up our doors and let people in and just get taken care of here. That's the vision.
Yep.
And that's what we're gonna do. And so today, to dive in, thank you for letting us kind of recap our feelings about all of this.
Yes.
We are going to be talking about bariatric FAQs.
Yep. Back to some basics here.
Basics. We did a podcast episode, it's been over a year now. Yeah, this 2 years. It was called Bariatric Potpourri. And I re-listened to that. And I think that's what kind of got me started on thinking. I was telling you that listening to my like tone and my vibe, I'm like, man, I was like free and almost like blissfully ignorant to what was to come on this journey. Like, I'm building a surgery center. We're having so much fun starting this business. And I want to get back to almost that vibe and that topic. And we are going to kind of start with the journey even before it's a journey. You have like that pre-op, but even before then, when you're still just contemplating if you want to do this. And some of the questions that you have as a consumer, as a potential patient, to get you in the doors virtually to maybe our practice, maybe somewhere else. Like, how do you come to this decision? Like, we talk a lot about the why, like the why you want to do this.
Yeah. I think that is the first thing. It's like you have to make that decision that either you're in it, which a lot of times when I talk to people for the first time, they're like, yeah, I've made this decision. It's not a question of if, but when. sometimes I get people who are still on the fence and things like that. And they're like, I'm going to go through the process and see what happens, blah, blah, blah. But most people by the time they get to us have decided. So I think that's the first thing, is just like deciding like, yes, I am going to investigate this. I am going to get into this somehow. And that's the first like commitment piece to yourself. And then it's finding, okay, now where do I go? And what do I do? And I think like, I guess, I mean, I'm guessing most people just Google it, right?
I think so. Yeah. I mean, that's how we find anything and everything. And you're looking at it, you're looking at reviews, you're looking at websites. I talk a lot. I do consulting all over. My passion is I want to increase access to care, and all those who qualify for bariatric surgery, less than 1% get it. And so I'm obsessed with, before I die, that number changing from 1% and beyond.
Yeah.
And whenever I'm looking at that, I think a lot of programs make a barrier to entry.
Absolutely.
And that is something that we try constantly to fixate on, our actual process of getting you in, because it's already kind of intimidating a little bit. Definitely have to get vulnerable, like all of these feelings to decide, like, I'm putting my information in their club. Like, yeah, okay, just did it. And okay, what happens then? Like, what is the tone from the practice, and what kind of communication happens? And I think this is where we are setting ourselves above because of the way we communicate.
Yeah. Yeah. So if you're not a Body by Bariatrics patient, or you've never heard us before, anything like that, we text all of our patients, and it is the most seamless part of our communication, I would say. And yeah, part of our core value, really, because we'll talk later a little bit about our 3 C's and all of that. But that's one of the big ones, is communication. And so you fill out that form and you're getting a text directly from us. And that's going to be a person answering you anytime that you respond to that. We don't have a chat bot. We don't have AI answering. Like, that is somebody. And oftentimes it's somebody outside of business hours.
Yeah.
So,
how many days a week?
Yes. So that, I think, is the first step. So I think if you're looking for a practice, like, look at that. What is that first step like? Is it some complicated form our form is not the shortest, I'll say. You have to answer. You got to if you're doing insurance check, you have to put your insurance info in and things like that. But, what does that look like? Am I waiting for a call for somebody that maybe never comes? It's like, click here to get started, and we'll call you, and then it's a week later, and there's a lot that can go through your mind in that time. And so, just having that ease of communication, I think, is clutch with anything, really.
Yes.
We talk about this with the med spa that we also have, and it's like, you want to be able just to go on and click, click, click and be done and not have to think about it. And that's kind of what we want as well. I mean, think about it, obviously, but, just make it easy. So easy. That is like always the first thing. So other things to look for, I think, in a program would be, like you said, reviews. I think that's really important. Looking at the providers, we know the bariatric community, it's a lot of women. And I think a lot of times people would like to see a female provider, if possible. So if that is something that is, important to you, looking for that. Looking, for some people, proximity is going to be something that's important. Now, we will see patients from all over. We're fully virtual as well on the consult side. And so we can see patients from anywhere. And we'll talk again about some self-pay things later that may be helpful for people in other parts of the country. But, looking at realistically for you, what do you need? Where do you need to be going? So what else can we look for?
Well, people also want to know, like, is this right for me? Who qualifies for this?
Yeah.
And, this is something that we kind of disagree with. It's really hard to have a consensus or a standard or some sort of guideline. Mainly for insurances, they have to have like rigid cutoffs so that it's like, all right, you're above this or you're below that. So that's it. So if you're using insurance, they do base it off of BMI. Now, about a year or so ago, they finally, after like 25 years, updated the consensus from the National Institute of Health and from the American Society for Metabolic and Bariatric Surgery based on BMI body mass index, that if your BMI used to be that if your BMI was greater than 35, you probably qualified. But now some insurances are getting more progressive because the evidence shows you're going to benefit if your BMI is greater than 30 and you have weight related issues, or greater than 35
without them. Yeah. But we are still seeing, sometimes it's that 35 and 40 threshold.
Yes.
So definitely. And that's something, again, that any program can check to see if you have that coverage and what that cutoff would look like.
Yes.
And there's BMI calculators online to search it, pretty easy. And, sometimes you're right there. And so, we're gonna check it. We're gonna see what's going on.
Yeah.
And then also for some of them, actually, this is one that we don't see too often, but people of Asian descent, it's actually lower. On most of them, it's 32.5 with a comorbid, and I think 37.5 without. For patients of Asian descent.
Exactly. So, I mean, there's just so much improvement with all of that. So again, if you want to see if your insurance covers, it's a free benefit verification. Just put in a front and back picture of your card. You can even text it to us. And then we have a service that we will check it for free. And we'll tell you not only if you have coverage, if you do, we'll also tell you what your estimated out-of-pocket expense might be. So we really simplify again, and we have a whole episode on this, but we explain things like copays, deductibles, co-insurances, maximum out-of-pocket expenses, if it's been met, if it hasn't, if you need to work out a payment plan, if you need to finance it, the hospitals, the facilities, the Surgical Institute of Central Florida, we can work out those sorts of payment plans and arrangements. So again, we want you to be able to have these procedures.
Yes.
And that's a huge thing. We've been really hitting it hard lately about going to Mexico, which is something that people do because, again, they want to have surgery and they want to make absolutely certain that they can afford it.
Yeah.
But also we want you to have the best results. And again, what I have learned from this entire process is, and I'm I'm very glad to learn about all the backgrounds on risk management, infection control, quality assurance, the random pop-up inspections that can happen that they just want to make sure that everything is, checked and balanced and done correctly.
Yeah.
And that stuff, I mean, I had a patient the other day who told me about a time that she went to Mexico, she had a sleeve, and that right before they were reeling her back, she said, hand to God, they had a garden hose, like they pulled out the green hose and they legit sprayed off the operating room table from the last person. And she literally saw, now I know that has a technical name, bioburden, which is essentially like blood and tissue and stuff off this table with a garden hose.
Oh my God.
But anyway, when I heard that, and then it's like, okay, I'm at the point of no return. I'm here. I'm like, they're reeling me back. And there's like a language barrier, perhaps. It's like, I guess I'll do it. Dear God, please keep me safe. And then that's
yeah.
I mean, I'm not trying to take her sleeve.
That needs to be redone.
Oh my God, her sleeve is horrible.
Yeah.
I have a theory on that. We'll get into that. I don't even know how I got on this. We're talking about finding a program, but honestly, her sleeve was performed so bad. And then this poor patient has really been blaming herself, thinking that why didn't I lose much weight? I think my theory on it is every Mexico sleeve that I've seen is so huge because I think they just want to get you, they take out like a sardines worth, they shove you back on the plane to the US. They want to make sure that you're not vomiting and dehydrated. It's like, oh, I'm doing pretty good because they didn't take out any stomach.
Yeah.
So it's like,
I didn't do it right.
No. So fixing that and all that sort of thing. So anyway,
Yes.
do your research, get your insurance checked.
Yes.
Hopefully we have an affordable, some sort of solution.
Yeah, absolutely. And on back to the insurance really quickly is I think a lot of times we get people that, text us or reach out and they're like, I'm assuming my insurance doesn't cover it. And it's like, well, you'd be surprised.
Yeah.
We have people that, or they find out not only does it cover it, it's covered at 100% or 90% or whatever. It's like great coverage, absolutely. So, always reach out. It doesn't hurt to check it. And the worst that we say is, no, sorry, you don't
Exactly.
you have an exclusion and you don't have coverage.
Yeah,
So-
exactly. And you'd be shocked. Some employers opt into having coverage that's so phenomenal that I get to tell people they've already approved it. You have a 100% coverage. Not only that, they'll pay you. They will pay you to get healthy. They literally will pay for you to have your gas, your mileage on your car. You would pay for a hotel room to stay the night before, after surgery.
Right.
They'll pay sometimes for your vitamins. There are actual plans that is so I kind of make out on this deal 1,000,000%.
Yeah, absolutely.
So yeah,
Yes.
Yes.
Amazing.
Oh yeah, that, that's pretty amazing.
Absolutely.
So you get into the program, all is great. So then at the consult, so tell a little bit about our way of doing the consult.
So the consult is a 2-part virtual consult.
Yeah.
I've said that before in my life. So basically you do like what we call like a group session, and that is where everyone joins. It's via Zoom. It's private though. Like you don't have to be on camera. You're not going to talk. It's just you. It's almost like a presentation or like a kind of like what some programs would make you go through before you could see the doctor. But this is going to be live. It's with you. Everybody joins, they watch, you do a presentation, you talk through our whole process, you talk through the surgeries, kind of give a background on bariatric surgery. And then after that, that same day, you'll see each of those patients one-on-one. And so that is when we get your history beforehand. So we know a little bit about you. We're sneaky like that. We get your history so that you guys can then have a conversation. You or Dr. Lane and the patient then can have just a conversation, find out what's going on with them. What are their goals? What has brought them to this point? I know you've said before, like people get really vulnerable in that one. You hear lots of stories. So I think that there's, that initial consult is really vital and having that like really personal discussion. And so we try to take care of a lot of the like, you don't want to sit there with your doctor who's asking, okay, have you ever had a heart attack? Have you ever, like you'll fill all that out beforehand. So they already know that. So yeah, that's that. And then basically then they get a checklist, and this is determined generally by the insurance. And then there's a few things that clinically you might decide that somebody needs. But if they need the psych evaluation, if they need nutrition consult, if they need ongoing nutrition education for a certain period of time, so we're going to send everybody like a customized checklist. It's not just, okay, here, now you have to go through a 6-month program because we said so. And we'll see you at 6 months when you're done. Like, no, if you don't need that, we're not going to make you do that. Of course, you're always welcome if you want to have a consult or you want to talk to me or anything like that, you can do that. But we're not going to make you do a bunch of unnecessary burden to get to surgery. Again, you've already taken this vulnerable step and you've gotten in front of us. So we're going to keep it moving. So you'll get your checklist. We'll follow up with you. We've got a team that does that on the back end. Leslie, our girl, we love her. She's going to keep track with you. She's going to text you, hey, you got your psych evaluation yet? Or what's going on? Or, hey, I got it done. They said they sent over the thing. And she's like, I never got it. And then she's on email like, oh, where's this person's thing? And then they send it over to her. She's actually really nice. She doesn't sound like that. So soft. So, so we'll keep track. And then that brings you to your final consult.
Yeah. Now people will ask all the time, like, well, why do I need a psych eval?
Why do they need a psych eval? That's an insurance requirement. So I think it's really outdated, to be honest. And I know that, mental health professionals might disagree, but it's not that we don't think that mental health portion of this is important. It's like, what is this evaluation actually telling us? And so really what the goal of it is just to make sure that there's no like glaring things that are saying that you're not going to be successful with surgery is kind of my understanding of it. Like, do you have a disordered eating? Do you have suicidal ideation? Do you have any of these other things? Like, it's only surgery, I feel like, that requires this.
Oh, yeah.
Besides, there's probably a couple others, but
I mean, this is the main one. Yeah, it is so outdated. So like people will ask all the time if they're going the self-pay route or if they're using, if your insurance company does not have that on there, like you just said, I don't make you do that.
Right.
We talk about this constantly, but I do think like therapy, helpful, great. A one-time psych eval, no.
What's it going to do for you?
Yeah. I mean, the answers. It's like they might be looking for like a hardcore like drug problem, but I mean, no, yeah, we don't get that weeded out or whatever.
No. And yeah, I just don't think I think it'd be more beneficial to say, hey, we'd just like you to meet with a therapist once beforehand. But then also the insurance should cover that. That's the frustrating thing is they require these. And then it's very hard oftentimes for people to find one that's covered by their insurance.
Yeah, it's nuts. Or even your visits. Like, I can't even believe that. Some of these insurances require all these visits with you and then they don't pay.
Right.
So we'll like just eat it. But it's like, well, why is that?
Yeah, it's not right.
It's not right.
Because this is their game plan.
Yeah, pretty much. It's like, who's behind who's the wizard behind the screen?
Yeah.
So Yeah, so you'll do all of your requirements. You'll have your 2-part virtual final consult. And during this is where a lot of these FAQs are going to come to light. So people during the initial consult, and I do like to keep the initial one very high level. Again, getting to know you, your goals, your struggles, your just your history, like you said, help to decide like, okay, here are the surgical options. I think this one's better for you. This is why. I want you to do your homework, make sure you understand. Okay, so that's more high level. Then we really drill down. Then it's like, all right, buckle up. This is a very dense 60-some page bariatric surgery success guide that we've gone through. And we start off right out of the gate on a pretty intense on one of the topics about the multivitamin and calcium citrate. So we get questions all the time. Do I have to take this for life?
Yes.
Why do I have to take it for life?
Because for the rest of your life, you're not going to, most likely meet your nutrient needs from food alone. Most people aren't anyway. Like, let's look at the realistic American diet. Like, people aren't meeting what they need. So then you limit that by portion. You maybe are limiting the types of foods that you're choosing. Again, especially early on, right? Longer term, maybe we're more flexible with what we're eating, but like you're limiting the types of food. So that limits the nutrients. And then there's malabsorption of those nutrients, especially in our bypass patients, that you're not getting everything is not utilized that you're taking in. So we need to supplement. So you have to take it, and it's at higher doses because we're kind of having to overcome that malabsorption threshold. And I've read too that there's even some degree of malabsorption with the sleeve, but not quite like the bypass, which is part of the bypass's magic. But I think that's part of it. And that never changes. Like that, this is a surgery that permanently alters your anatomy. So why would it change after a year? So yes, you are going to be on them for the lifetime. Find one that works for you. It might take some trial and error. If you can find a good bariatric one a day for your multivitamin, that's perfect because it's one a day. Like that's it. And then you'll take calcium citrate 3 times a day. And again, you just want to find the one that you tolerate and you like. Some common things that we might see. This is another one, especially after you've seen patients and they come to me for a consult or ongoing treatment, whatever it is. A lot of people come to you and say, I want the sleeve. And then you're like, actually, I think the bypass would be better. And the question is always like, but, what about the vitamins and this and, long term? And it's like, yeah, people that had the bypass 30 years ago maybe had some issues. We didn't know, so now we know better and we do better and all of that. But also I'm like, we keep an eye on things. And so the common things, we check it at 6 months, 1 year, and then annually from there on. And the most common ones, some if you agree, vitamin D deficiency, which
My number one was called.
again, common in the general population. I had vitamin D deficiency on my insufficient. I was like 29 and 30 is the cutoff. Come on.
That was in the teens.
Oh yeah. So anyway, we'll check it. We're going to check it there. B12. And that one is also because we set a higher threshold than like the normal.
Yeah.
So we actually have a higher cutoff. So sometimes you're in that range too.
Yep.
And then iron.
Yes.
Iron deficiency, anemia, kind of those types of things. So we're going to check those. And then we're going to tell you how to fix it. We're going to say, go get, if your vitamin D is 29, we're going to tell you to take 2,000 IUs a day.
Yep.
If your vitamin D is 8, we're going to tell you to take 50,000 a week for 8 weeks, and then we check, and then we do that. Like there's protocols for all of these things. So, that's what we're going to do, and we're going to keep an eye on it. We're not going to let you just like walk around not knowing what's going on. And your primary is going to do the same thing.
Yeah, and we do like to own that. So we do have lifelong follow-up. We have Amber, our physician's assistant, who is bilingual and so sweet and so
good.
Thorough.
Oh my gosh.
Hand holding.
Wait, can I tell you though, the other day, I was sitting in here, we're obviously at the office today, and Amber's office is like just down the hallway, and the door was open, and I can't hear her talking, but I can't hear what she's saying, but I can hear her talking. And I'm sitting here, and all of a sudden she is like cackling, like cracking up, dying with laughter. And I was like, no wonder she's like, she sometimes runs behind on her appointments. What is she doing laughing this hard at an appointment? Apparently a patient thought we told them that they couldn't have sex for 18 months after surgery. Not that they couldn't get pregnant for 18 months after surgery. And she was like, no. And so then they were both just like laughing so hard. But I was like, what's happening there the other day? So that's what you're gonna get with Amber. Sometimes you're gonna be laughing with her on your post-op
She's
visit.
super personable, super sweet. What you see is what you get. We're going to follow up on it. We're going to make sure that you are great, because sometimes you might feel fine, but you really don't realize that you're not.
Or you don't know what's going on. You're like, because a lot of the vitamin deficiencies too, people are like, oh, could this be a vitamin deficiency? I'm like, I mean, you're fatigued. It could be 8 different vitamin deficiencies. You know, it could be vitamin D. It could be your iron. It could be your B12. Like, I don't know. That's why we got to check and see. But I also think that's why it's important that we don't tell people just to throw a bunch of vitamins at, you know, like we're not saying take a multi and zinc and vitamin C and we do tell you to take iron, but you know, like additional vitamin D and blah, blah, blah. Like we don't pile. It's not like this huge stockpile of vitamins that you have.
No.
You get a really good quality bariatric multi, and that's, you're good. And then if you need 1 or 2 additional things, fine. We're talking about something like an omega-3 or a fish oil or something, you know, for other health issues, you can absolutely do those, of course, too.
Yeah, we get questions about that all the time. People have different, very strong opinions about supplements, and something like, you're not familiar with some random thing. Like, I'm not.
Ashwagandha after bariatric surgery.
I know. Actually, Irene was talking about the other day. Wasn't she, about like it helps with bleeding and bruising?
Interesting. It is not good if you've had a kidney transplant. I know that.
Wow.
I read one paper about that, but.
Well, Hannah was a dialysis registered dietitian for many years in Chicago, which is very complicated nutrition.
It's tricky.
It is super tricky. Dialysis is the hardest thing. I always feel
I think pre-dialysis kidney disease is harder.
You do,
because you're trying to prevent progression. So dialysis, kind of just have to give up on some things because we'll just dialyze it out.
Yeah.
We're not worried about damaging your kidney anymore.
So yeah, there's things there.
Yeah.
Lots of layers.
Yeah.
So
favorite pathway here.
So we get lots of questions about vitamins. Also, they ask about just like return to work. That's probably a big one.
Another big one.
When can I go back to work? Well, I say you can take as little off as you want, or up to 4 weeks. So obviously you'll be off for the day of surgery. The next day you're going to be probably pretty beat up.
Yeah.
I'd say the average is 1 to 2 weeks.
Yeah.
You help tremendously the most with our practice on paperwork, FMLA, work excuse notes, return to work with restrictions or light duty, a combination thereof.
Yeah.
So
yeah, I would say, you know, I always tell people, I'm like, it really depends on your job. That's the first thing. Like, if you're like me who commutes to their guest bedroom and sits in front of a computer most days, like, yeah, you have surgery on a Friday, you might be back on Monday. You're feeling okay. And especially if your job is like a little more flexible or understanding and knows, you know, you kind of are making your own schedule or something. If you're in high demand, you're on calls all day or something like that, you know, it's going to really vary. But then I have people that are COs in prisons. I have nurses, a lot of healthcare providers that are, you know, bedside. Like those people might need a little bit longer. Yeah. Or if you're somebody who's working like an Amazon facility or something, or you're moving a lot of materials, like, yeah, you're going to need a little bit longer. But if by 4 weeks you're not feeling well enough to return to work, we need to investigate what's going on, because you should be 100% ready to go back to work. 4 weeks.
And feeling even better than you did before surgery, because at that point, you've already lost probably 15 to 20 plus pounds.
Yeah.
And, you know, like you said, you're a little tired in the beginning.
Yeah.
So you're a little white. I mean, it is still a major operation.
Yeah.
You're figuring out your nutrition. You're getting maybe a little bit less protein or fuel, and you might be a little ketonic. We talk about the keto flu, like all of these kind of vibes. Totally normal. Some days are better than others.
Yeah.
But you're going to figure out your flow and get things, you know, going. Some people are like, I'm taking off as much as I can because I just want to do this right. And
they want to learn your fullness cues. And I appreciate all that too. I think it's great. If you can do it, that's fine. But also remember, folks, FMLA does not pay you. So
yeah,
short-term disability does. The FMLA does not.
Yeah. Short-term disability only pays a percentage too, doesn't it?
60% usually. Yeah.
Still, it's not 100.
Nope.
So some people are like, can I go back tomorrow? And we're like, you can, if you feel up for it. Like if you're taking narcotics, you can't drive. So, and they make you tired and groggy and, you know, that's why. But
yeah. One day after surgery, I would say, I wouldn't push it that hard, but 2 days, maybe.
I know.
So people fly back 2 days.
We do. That's another great question.
Yeah.
So talk about what are the expectations for time in town if you're coming and flying in from out of town or driving in from out of town?
Yeah. So I would say if you're coming, from out of state, especially, of course, we have people that come from different parts of Florida where maybe they're 2 hours away. You could do that. I mean, depends on what time you have to be here. You might want to stay the night before just so you're nearby and easy to get here. But, if you're coming from out of state, you're driving for more than a couple hours or flying. We want you there the day before. That way, if something gets delayed, your flight, doesn't take off on time or something happens, you have some flexibility built into that. So we want you here generally the day before. And then obviously day of surgery, we want you to stay about 1 day post-op. And then the third day or the second day post-op, you can fly back. So you'll stay 2 nights after surgery, basically.
Perfect.
And then leave out. And then, when you're in the car, on the plane, you just kind of want to be up and moving, every hour or every 1 to 2 hours, get up, get an aisle seat so you can walk it up and down the aisles.
Perfect. Yeah, that's it. It's really simple. And that's the whole point. So we want to make it so that you come in, it's really nice. You can safely go back home. And again, everything's virtual. So you'll have all of your follow-up care. We text you the day after. You can text us anytime. You can call us, blah, blah, blah. So there's a lot of communication there as well. People will ask a lot about incisional care. When they can get those incisions wet, what is it like?
From my understanding, they are waterproof, so you can get them wet right away.
Exactly.
You can have people go in the pool.
I'm fine with it.
Yeah.
I mean, these incisions are so tiny. I mean, we do the most.
Show me. I want to see.
Okay, so 3 of the 4, there's 4 total, and we do less incisions than anyone else. You're never going to find a bariatric surgeon that does less than 5.
Yeah.
Because we don't use a liver retractor. So we only use 4 total, 3 or 5 millimeters, which is the tip of the pinky.
Oh, wow.
And then 1 is 10 to 12 millimeters, which is the width of the thumb.
Okay.
Nail. That's it. So we try to keep them very, very small. And then we put these little trocars in. And then we have our YouTube videos. If you want to watch us doing a gastric bypass, a sleeve, a revision, you can check those out as well. And then we close it with a plastic surgery closure. So I get asked all the time, do I have to come in to get the stitches removed? Like there's no stitches on the outside. They all dissolve under the skin. They ask if there's staples. There's no staples. There's nothing to remove. And then we basically throw one little tiny stitch to pull that skin edges back together. And then we put a thin layer of, it's called Dermabond, and it's a waterproof skin glue over just over that little area. Some people, especially if you have white skin, you might have some irritation with adhesive. So sometimes like the tape from the IV site, that might get a little red and irritated. Sometimes you'll see like little bruises around the incisions. And sometimes people will have like just a little focal irritation from either the chloroprep, which is the skin kind of what we clean it off to sterilize it with, or from the glue itself. And if that's the case, we'll just tell people they can pick it off a little early, but otherwise just leave it be. It'll either fall off. If the edges start to peel up, you can pull it off at that time. It might get a little bit just itchy after a while.
Yeah.
I guess a snack on your clothing, like, all right, pull off this layer. Yeah. And it's like a liquid Band-Aid, and that's it. Nice. And then they can swim, get them wet, take a shower that night. Some people just want to like, let me get this gunk off of me. We try to scrub you down really nice so that it's like, oh, wow. But like, we try to make sure that everything looks
like after being on a plane, you just want to shower.
Yes.
Yeah.
Totally.
And to that can help a lot of people. That like warm, steamy environment, I think helps people like relax a lot. And like, just like when you're sick, it's like, I've been sick the last week and I feel like I just keep going standing in the shower. It's like, I don't know, the steam. It feels great.
So good.
Yeah.
And we talk a lot about showering in terms of our thoughts. If a shower doesn't come into one of our Weight Loss Collab episodes, it's not a good episode.
Not a good episode.
So definitely shower. We also have an episode called, Hey, I just had bariatric surgery. Is this normal? So go back and listen to that. We talk a lot about those first, again, minutes, hours, days after surgery. And we talk about some troubleshooting tips to help with the gas pains, the incisional soreness, different things like taking a shower and just relaxing. And I think it does make you feel a lot better.
Yeah.
No doubt about it.
For sure.
And then we get questions a lot about the diets.
Yes.
Tons. That's the number. You're the star of this show.
It does feel like that sometimes.
You really are. More than the surgery. People want to know, like, I mean, what do we eat?
Yeah. Well, because what do we do every single day? We eat, and people have such a strong relationship with food and all of that. Ultimately, I'm going to keep it brief. I'm going to just give some of the high level, and then we're going to be coming out with another. We have some basic nutrition episodes already, so you can go back and listen to those. We're going to do another one to like just really get into it a little bit more in depth. But 3 meals a day,
Yes.
protein at each meal, starch-free diet. Those are the 3 key things. I tell patients on that. I'm like, those are like the 3 things. If we can like hone in on that, you're going to be sitting pretty. And so 3 meals a day, that's pretty self-explanatory. Protein at each meal. All right, so what's protein? Our animal proteins: beef, pork, chicken, fish, eggs, dairy products, turkey, seafood, animal protein. And then you have our plant-based protein. So things like soy products like tofu, tempeh, edamame, TVP. There's seitan, which is a wheat product. So, and then some things, we're going to have like beans, lentils. Those are going to give some protein, nuts and seeds, that kind of stuff. So having a variety of your protein sources, you want to make sure that you're getting 20 to 30 grams at each meal. And then the starch-free diet. This is arguably the hardest part for most people. But I always say that making this change is harder pre-op. Because after surgery, you're just going to get full so quickly and your cravings are not going to be there like they are before surgery, that you're like, oh, this isn't really that bad.
Mm-hmm.
Eventually you'll want to reintroduce them, and that's fine. But like early on, it's kind of like, oh, most people they don't care. I don't know. So that's going to be avoiding rice, pasta, potatoes, corn, peas, anything made from grains, our high sugar things like candies, cookies, cakes. Technically not starches, but I include them in this, is our sugary drinks. So sodas, juices, lemonades, sweet teas, things like that. Any of those really high sugar things that we want to avoid. And yeah, that is going to be the basic. So you're going to choose your protein. You're going to pair it with a non-starchy vegetable. That's going to fill up most of your plate, those 2 things together. And then we're going to include some high fiber foods like fruits, lentils, beans, nuts, seeds.
Wow. I want to dive in so bad, but we're going to have a whole nother episode on nutrition 101, the bariatric basis. And like you said, we have a lot of episodes on this. I'm very curious about your thoughts. I'm just going to put it out there on total net carbs. I'm really obsessed with that. I know you are as much.
I wouldn't say I'm obsessed, but I use them.
Okay. Yeah. So we're going to talk a lot about what is a net carb versus total carbs versus sugar alcohol versus fiber.
Reading a nutrition label is a whole thing too.
Yeah. We're going to teach you how to make sure that you do that. And that becomes, if it has a label, you read the label, that becomes such a part of just your automatic response to food and all that kind of stuff.
Until it becomes routine, and then you don't have to do that so much.
I know.
So
there's a lot of other FAQs out there. Oh my gosh. So many.
I mean, we just got to the final consult, basically.
No, there's so many things. There's all kinds of post-op things. There's people want to know about hair loss. People want to know about their bowel habits. Are they going to get more constipated? Are they going to have diarrhea? Are they going to have constant stomach issues? What is relationships going to be like? There's like just so many things. People constantly obsess over the unknown. Like, what will this be like for me?
And I think that it's really important to ask those questions. I think, though, a lot of people get in their heads about some of that stuff. And ultimately, if you look at people that are maybe not even the first year post-op, but that are a little bit further out, their lives are pretty normal, And I think that it's hard to see that, because in the moment you're like, oh my gosh, I'm making this huge life change. And it is. I'm not like going to minimize that for anybody, but ultimately, like long term, that stuff's not going to be an issue.
No.
And I don't think people believe us when we say it. I definitely sometimes have people, usually it's like, gosh, I don't know, 3 or 4 weeks after surgery, I'll have this like random, visit on my thing. And I'm like, what's going on? And usually if somebody has a problem, they're like, well, this is what's happening. And then I get some people, I'm like, what's up? And they're like, things are really good. Wait, okay, so why are we on this call right now? Like, I need a problem to solve here. And they're like, well, no, I just feel like it's just everything's been too good. I'm like, no, that's great. That's amazing. That's exactly what I want. And so, wow, there's that doubt in people's mind that it can't just be great. And I always tell people, I'm like, part of it is that if what you see online, what you see people talk about is always going to be the issues, because they are looking for a problem to solve. And so they're putting it out there. I'm having this concern. I'm having this. I'm like, is not posting online the person who everything is going great for, because they don't have a problem that they need to be solved. They're just like living their lives. And so I'm like, it's like the majority of people. You get the ones that are a little bit louder because they just need a little help. But a lot of people are just quietly doing their thing. And so I think it's like that doubt in there.
I love that. You're right. People are just like, we are here now. People are just humming along. I am doing well. You know what I would love to do? I know I used to come to your house like back in the OG days of this whole thing. I would love to hear like your spiel and your approach. Do you feel like you kind of have a structure to it, or is it just kind of like a conversational type of a stance you take?
Try to make it a conversation because and I tell people this, whenever we start a thing, I say, I always start my visits by seeing if they have questions or any kind of topic that they want to focus on, because everybody is going to have something that's different and unique to theirs. And I don't want to just sit here and say, well, this is what you need to do. And I'll do that if you want me to. But like, I think it should be tailored to that person. I think I catch people off guard a lot of times. They're like, oh, I don't like, they need something in their hands to be prepared or something. It's fine if you don't. Like, I can get started. I can guide it. But I always like to start that way. But definitely, I mean, a lot of people we talk about, again, those kind of like 3 basic things. I'm obviously can rattle off a lot of foods. Yeah, that's what I do all the time. It's just rattle those foods off.
I was impressed by that.
So, I try to kind of touch on some of the other base. We talk a little bit maybe about exercise. If I talk about the vitamins and things, it kind of depends on what else is going on. I'll ask people like their weight history a lot of times just to see where they're coming from. Is this something that you have been dealing with since you were 8 years old, or has it been since your last pregnancy? And because there's a difference too in how people have that relationship again with food or with their body and the struggles that they've experienced. That's 2 vastly different patients. So even the other day I was talking to somebody and I said, it was this man, very tall man that I was talking to, and I was like, the reason I asked this is because your issues are different than my 5'1" woman. Yeah. Like you're totally completely different people. And so, yeah, I try to tailor it and have it be that more conversation. But sometimes people just want like,
yeah, just tell me what to do.
Yeah,
I'll do it.
Yeah.
Just give me that shopping list and tell me how to meal prep and tell me exactly what to do and think, please. And can you be there and prepare the meals and buy them for me? Okay.
I can hardly do that for myself right now. So,
I know. Well, you got a lot going on.
A little bit.
Yeah.
So, so that's kind of it. But again, we'll talk more about that. And maybe I'll just do a consult with you. How about that?
Yeah. Always virtual, very convenient.
Absolutely.
And we also do a lot of support groups. That's another reason why when you're picking a program, you want one that is not going to sleeve you and leave you. We are there for life again. And we offer every 3rd Tuesday of the month at 7 p.m. Eastern.
Yes.
We go on Zoom, and sometimes we'll have a topic. Sometimes we have a guest speaker. We just had Dr. Irene Tower on, and that one was the best ever. It was really good. It was really, really good. And it talked a lot about her services. So we do have people ask all the time about the loose skin. And we have a whole episode and a whole blog and so many episode notes and things about that. We do offer cosmetic surgery now as part of this one kind of comprehensive experience. But on those support groups, you can get your questions answered. You're almost always on them. I'm almost always on them. We do some that are just Q&As.
Yeah.
Some of them are, who needs support? Just stop talking. And people come on camera or people just put in the chat. It's very interactive.
Yeah. Yeah.
So we have all that.
We do that. We're doing some more in-person stuff now that we have the space.
We had Top Secret exclusive by invite only event coming up.
Yes.
So you'll see some of the after and they'll be like, wait, I didn't know anything about this. That is because we announced it at our last support group. So we're doing something really cool.
Yeah. So but there will be more things like that to come. We have the walking club. Yes. Now at Lake Eola.
That is really great.
So Amber puts that on. There's so many things. So these are all things to think about. Again, going back to if you're choosing a program, all of these things are things to think about. And just, you want something you can trust. You want somebody that is there for you. And, obviously we hope that that's us for you, but it could be somebody else. It could be, maybe you had a friend that's had surgery and they had a great experience at their program. I think, firsthand experience is always going to be the best indicator. So, talk to people, ask people, you just have that conversation. And
Very much so.
Okay.
So the 3 C's are
Yeah.
fixing. We have a great community.
Mhm.
We are very convenient. We offer virtual consults before and lifelong virtual follow-up after. And finally, we communicate easily. We text. That's it. That's very profound thoughts here. That was just
Summing it right up.
that's it.
Yeah.
So lots of other questions. We're going to keep diving in, but make sure that you join our private support group on Facebook. It's the Body by Bariatrics, Weight Loss and Bariatric Surgery Support Group. We have over 10,000 plus members in that group. And you can get your questions answered on the spot 24 hours a day by either another patient who's been there, done that, felt that, can help you with their advice. Or we are also overseeing that and checking it out and chiming in. And mainly, pretty much all I do is I'm like, heart that, amazing, congratulations, you're outstanding. It's Friday, for example. I'm like, oh, face-to-face Friday. They are. Look at those slim beauties. I know.
Love it, love it. All right. Well, then, of course, you can find us on Instagram at the Weight Loss Collab. You can find me at hannahschuyler.rd and her at Dr. Dovec. And if you're ready to get started with that consult, go to bodybybariatrics.com. We'll get you going.
Yeah, and we have an FAQ section on our website too, but searchable FAQs and financial FAQs. So hopefully you'll find a lot of information on our website. We'll keep expanding upon these FAQs, and we'll be back very soon with another episode that breaks down even more.
Love it. All right. We'll see you next time.
Bye, guys.
Bye.